Welcome to every one of us. How are we doing? I hope we're doing very great. I hope our week has been well. So we're all highly welcome to this evening's broadcast. As usual, we're broadcasting on Instagram, on Facebook and YouTube. And we are ready here today for us. Remember, during our advert, we advertised that we're going to be handling the second part of our vaginal diseases in women. And today we are looking at natural remedies for menopausal atrophic vaginitis and also gonorrhea. So we are all highly welcome. If you join me live, kindly greet so I can welcome you to this evening's broadcast. And then as I share, I welcome you, and then we go over to our gist for today. So we are all highly welcome. Welcome to every one of us. We are all highly welcome. How was our weekend and how is our week going? I hope we're having a good time this week. I hope we started the week with energy. It's always good for you to start a thing with energy, because when you have energy, then you're able to pull through. But when you start and you don't have that energy, you're not able to pull through. So I hope you started your week with energy. It's practically the last week of October, because the month will be ending very early next week, and then we enter November, the second to the last month of the year, and my birthday month. Wow. We're going to be having a lot of fun. It's usually a very good fun time during my birthday, so we're going to have a lot of fun time in our live broadcast. We're going to do as many as we can, even though it's quite a very busy month for me, plenty travel here and there, but it's going to be really fun. So please kindly join me to share. I'm already sharing to all the people in my groups. Okay, I'm already sharing now, so help me share, and then you can greet so I can welcome you to this evening's broadcast, whether you're on Instagram, whether you're on Facebook, whether you're on YouTube, whichever way you are watching us live this evening. Please kindly greet. I know that the topic is not very common, where people will rush, but that atrophic vaginitis is very important to know about it, especially people who are already in their perimenopause, who are about to enter their menopause. Because by the time you enter menopause, if you don't prevent, if you don't know what is happening, and you don't do something about yourself, about your life, so that you can prevent it, you will now be running helter-skelter from one place to the other, thinking something very out of the way is wrong with you. That's why knowledge is power. That's why it's actually very good for us to know these things, so that we'll be able to put them into use. So we're going to be looking at some of these diseases. Prevention, like I say, is always safer, cheaper, and better than cure. So we're going to look at the prevention. And like I said, if it's not your fault, you have a partner, your husband or so, who will bring some of these things your way, so that you will know what to do to prevent them, so that you will know what to do for early detection and then early management of such issues. So we're all highly welcome. One more place to share, and then we get going with today's teachings, and then ask your questions, greet, and let me welcome you. Hello, Dolapo. You're welcome. Dolapo, you're welcome to this evening's broadcast. Thank you for joining me. Thank you for also being I don't know, it's just 1 minute ago. I'll have to check to find out who was the first. Because was it on Saturday when I said someone was the first? By the time I now went, I found out that I wasn't that person. And even the person that was first now said, "No, I'm not the first." I said, "Okay, not to worry. I announced the wrong person, but both of you will get it." All right, so welcome Dolapo, welcome Manda, welcome Amaka Cyril. All right, so I always give a gift to the first person that greets, and I can have 3 of you greeting the first. Amaka Cyril, welcome. Amaka Cyril is one of my 100 influencers. Well, you're the first, one of the first 3. Good evening, Amaka. Good evening, welcome, Manda. Welcome, the lab. So I'm going to put my WhatsApp number here. 3 of you are getting a gift from me. So chat me on my WhatsApp number. My WhatsApp number is +234 703 515 1642 +234 703 515 1642. That's my number. So chat me the first three people that entered: Erulu Dalapo, Mau Manda, Amaka Cyril. So chat me on my WhatsApp number so that you can get your gift for being the first three to enter. Hello, Fola Adeoye, you're welcome. Welcome to this evening's broadcast. Welcome to every one of us. I'm so excited to have us in the broadcast this evening. All right. So, like I was saying, it's common for women to experience vaginal issues on an occasional basis. It's not a frequent thing, especially for any woman who is keeping herself very well and keeping herself tidy. So, but vaginal problems can arise from either shifts of menstrual cycle or from menopausal symptoms. Some of the menopausal symptoms you might begin to have and you're not handling them. Even from birth control pills and birth control methods that we use. Some people get to develop vaginal issues from there. And like I said last week, our vagina is very delicate, but it's self-cleansing. It's a self-cleansing part of our sexual organs, but from time to time, we might notice that it's not functioning the way it's supposed to function due to some of these things I have mentioned. So when you notice a discharge, an unusual smell, a sensation that includes like burning, as if it's burning, as if it's itching, or other comforts, it's very, very important for you to know that it's not usual. So a woman is actually at that period unsure of if she's okay or is just passing through one kind of thing or the other, or if it's a sexually transmitted disease she's having. And when one is not sure of, sometimes it can impact one's wellness, and sometimes one may even begin to wonder, oh, maybe is it yeast infection, is it gonorrhea, or some of these contagious diseases that one is having. So many common infections can also lead to vaginal diseases. So it's very, very important for you to be aware of your own wellness. Like I always tell women, understand your body. Learn your body, understand your body, try to let your body speak to you and understand the language your body is speaking. Is very, very important for you to do so, especially once you have started menstruating as a young girl. We need to teach our young girls to also understand their bodies, because sometimes when some of these things are not taken into consideration and you don't catch them early, prevent them at that early stage, they can become something way out of it. So last week we looked at 5 common vaginal issues in women. Today we're going to be looking at the remaining 5. And the 10 I mentioned last week was 1, vaginitis. Go and watch last week's video. We looked at also bacterial vaginosis last week, Monday. You can go and watch the video. We also looked at yeast infection, which is also contagious. We need to go and look at it. And we also looked at number 4, trichomoniasis last week. And then, of course, the last one we looked at last week was human papilloma virus, which is the HPV. So today we're going to look at the remaining 5. And the first one we'll look at today is genital herpes. And then we're also going to look at gonorrhea as number 7. And we're going to look at chlamydia as number 8, and then vulvodynia as number 9, and then the last one, which also pertains for middle-aged women, the atrophic vaginitis. We are going to also look at it today. So those are the 5 we'll quickly run through today. I want to be very, very fast today, okay, so that we can finish on time. I'll be able to share the video and people will watch it. So we're looking at the 6th one. Watch last week's video if you have not checked the first 1 to 5, okay? So the 6th one today will be genital herpes. And genital herpes, is caused by 2 viruses, the HSV1 and the HSV2. And many people who contract genital herpes don't experience any symptoms at all, but some people develop herpes sore, okay, around their genitals, around the rectum, and also the mouth. Okay, so when you begin to have like sore in your mouth, on your genitals, or your rectum, then it's also it could be a symptom of genital herpes. Is herpes Contagious? Yes. Genital herpes is common sexually transmitted disease. It's one of the common sexually transmitted disease. Even when a person does not present any symptoms, it's still a sexually transmitted disease, and it's very, very contagious. Okay, so what are the symptoms and signs of genital herpes? All right, usually for the medical care providers to detect if one has genital herpes, they will make a swab, on the areas of visible active herpes infection, or where they see those symptoms. Okay, even when the symptoms are not active, they can use blood tests. So they give a number of herpes antibodies present in the body. They'll be able to measure that with the test they do. So developing either a single cold sore or a cluster of multiple sore called vesicles that form on the lips, inside the mouth, or on the genitals, or on your buttocks or your upper thigh. When you have some of those things, those sores can sometimes be very, very severe and painful, and they can rupture and cause fluid to be scattered all over the body. And some people develop other symptoms during these herpes outbreaks that are similar to those caused by cold and flu. And that's why it sometimes is very, very difficult for one to know whichever one is having. And again, other symptoms that might come with it, apart from all those sore that could be one, or clusters that are many around, like I said, in the mouth, on your lips, on your genitals, or on the anus rectum side. You could feel fatigued. You could feel irritable. Of course, when you have all those sores and they are itching, they could be very, very irritable. And you can have aches, and sometimes it comes with fever. Some of these infections actually come with fever from time to time. Now, what are the risk factors for acquiring herpes? Okay, herpes, genital herpes. Some of the risk factors include kissing someone who has symptoms of an active herpes virus. Okay, and that's why it's a sexually transmitted disease. Kisses. And some people who you have friends, you want to give peck, you want to go all over, all to the mouth. It's very, very important for you to be very, very careful with that. And then also engaging in sexual intercourse, unprotected sexual intercourse without using condoms and things like that. And also having all these people who, I know it doesn't concern us here, but let me just say, people who have sex with multiple partners. If you have a man, like last week I say waka man, or if you're a man, you have waka woman. If they have sex with multiple people and they now come and have sex with you safely in your matrimonial home, you can contract it. Okay, so spreading the virus through contact with cold sores on the eyes. If somebody has eye-to-eye contact, or secretions on the fingers, or ulcers sore on the buttocks and upper thighs. These are some of the risk factors. Okay, then having certain other illnesses that can lower your immune system, like people who have HIV virus, people who have autoimmune disorders or hepatitis. When your immune system is lowered and you get in contact with people who have this, you're not able to fight it as fast as you should. Okay, so it can now make such diseases to come up very, very fast on you. And that's why it's very, very important for one to make sure you boost your immune system. Like someone was telling me today that she got cold because their children resumed from school. In school, she's not in Nigeria, and so the children just resumed. When they got to school, they mixed with other children. The children got cold. They came home and gave it back to her. And I was telling her, I said, look, when my children anytime my child is going back to school, I arm that child with immune blend. This is immune booster. I arm that child with immune blend because it's an immune booster. And even me myself, I make sure when cold season is coming, or I'm not sure of where I'm going, like when I want to travel abroad now, sitting in the plane for a long time, I make sure, in fact, I never travel without my immune blend. I start taking it like a week or two before I travel, a week or two into my trip, and sometimes all through my trip, because that will help to boost your immunity. When you have lowered um, immunity, it can bring all these things. Not that it's already there or that your body has it, but it's easier for you to contract all these contagious diseases. Then again, another thing is eating poor diet. It could cause nutrient deficiencies, and then it can also lower your immunity. So how do you get rid of genital herpes, or how do you prevent them? Boost your nutrient intake. That's one of the things, because it's contagious. And of course, remember, through eye contact, through kisses, through maybe your finger, if there's an open wound or something, touching anybody in all these areas that we have mentioned. Okay, so you need to boost your nutrient intake. Make sure you're taking enough fruits and vegetables. Make sure you're taking enough omega-3 fish oil. I have my omega-3 here. I even forgot to take my omega-3 when I took my dinner, so I'm going to take it now. And Ginika, one of my global influencers, taught me to chew it. So I have my omega-3, the best omega-3 you can have out there. I'm taking my omega-3 now. All right, I love eating it. I love the flavor of that fish, nice flavor that you can have. Then also, you need to avoid inflammatory foods. Avoid alcohol, avoid packaged food, avoid processed food, avoid acidic food, and also take your supplements to boost your immune system. Like I've said, these two supplements are fantastic for prevention. They are fantastic also for management and making sure you get rid of these things. All right. So I'm going to go to number 7. The seventh common types of vaginal diseases that women can have is gonorrhea. We all know gonorrhea. Gonorrhea, definitely everybody knows that it's a sexually transmitted disease caused by bacteria that is spread through contact with the penis, contact with the vagina, contact with anus, contact with mouth of any infected partner. And that's why it's very, very easy to transmit it sexually, because of course, when someone is having sex, kisses, intercourse and things like that. Again, during childbirth, an infected mother can also transmit gonorrhea to the baby, which is also very, very unfortunate. So what are the signs and symptoms for women in reproductive, in the reproductive tract? Includes 1, painful urination. When you begin to urinate and you're having pain, you need to check it. Number 2, vaginal bleeding, especially after intercourse. When you finish having intercourse and you start bleeding, watch it. It might be gonorrhea. Number 4, vaginal bleeding in between your periods. Okay, you finish your normal cycle and then suddenly you start bleeding. It could be gonorrhea. And then pain during intercourse is another symptoms and sign of gonorrhea. Or sometimes you have abdominal or pelvic pain, okay, and also increased vaginal discharge. Or that's also part of symptoms of gonorrhea. Now, what are the natural remedies for gonorrhea? Prevention and management. Apple cider vinegar is one of the things that is known to fight infections. And certain types of bacteria, viruses, and fungal, it can be helpful for you to use apple cider vinegar. And also, like I said, our immune blend is fantastic. It's already known all over the world about this immune blend. It's a very, very perfect accompaniment to gonorrhea treatment. Even if you're taking natural gonorrhea treatment, medical gonorrhea treatment, or drugs and the rest, add immune blend. Immune blend is fantastic because it's a supplement that gives your body what your body needs to heal itself. So while you're taking other treatments, or you're taking some of those treatments, some people go natural, herbal, and things like that, it's good for you to take this immune blend, to add it to what you're taking. It will help boost your immunity so that you'll be able to fight that gonorrhea disease. And again, another thing some people use is Epsom salt. It's also a powerful detoxifier. And again, another supplement that we also use is L-arginine. We use our L-arginine. I don't have any stick here. I know that I used it for my drink yesterday. It's inside. Incidentally, I asked them to bring it out. They didn't bring it out. Our L-arginine, we also use it as for it, especially it's a little pricey for those who might not be able to afford it. But if you're already having gonorrhea and you need to work on it, you need to take some supplements for it. I show you the best sets that are affordable you can use. Our um, Imu blend, a probiotic, okay? You can use raw honey, you can use our garlic, you can use our bee propolis, okay? Very, very good. You can use the honey also. These are very, very good for you that you can use in management of this. And of course, the Active C. So these are some of the supplements you can use if you're having gonorrhea. All right, so the eighth one we're going to look at today is chlamydia. Chlamydia is most commonly diagnosed in young women, in very young women, because most of the people who contract chlamydia don't experience symptoms, and some of them may just notice abdominal vaginal discharge and burning sensation while urinating. And chlamydia can also affect the rectum, which results in discharge, bleeding, and rectal pain. Okay, chlamydia also is contagious and it is a sexually transmitted disease. Even if you don't have any symptoms, you can still spread chlamydia into a sexual partner. Antibiotics are actually the known cure for chlamydia. And again, one thing about it is that prompt treatment will help to avoid serious and complications for it. Okay, like I said, antibiotics is one of the major um, most common treatment for chlamydia, but also you can actually use like some supplements, especially if you want prevention. Like I said, if you have a partner that is wakaing about, it's not good for you to stay on antibiotics all life. But some of these supplements, you can have them and have them every day because they don't have side effects and they can help boost your immunity, and they can also help for prevention for you. Again, Immune Blend and the our garlic thyme, very, very fantastic. You can still have your Imu blend and garlic thyme if you want to prevent. If you have a partner you're not sure is going up and down, it's good for you to be on these two to prevent all these sexually transmitted diseases as much as possible. And of course, use your condom where necessary and make sure you keep a very, very clean and hygienic home. So risk from chlamydia: passing the infection to others is one risk, and then painful urination, vaginal discharge, bleeding, lower abdominal pain, infertility. Chlamydia is one of the things that can lead to infertility in women. Infertility in women. Chlamydia can lead to that. It can actually also lead to ectopic pregnancy. For a woman who is pregnant and she contacts chlamydia, it can lead to ectopic pregnancy. And also it increases the risk of other sexually transmitted diseases. And in men, it can also lead to prostate infection. A man that contracts chlamydia can now have prostatitis. It can lead to prostatitis. So it's very, very important for one to avoid all these sexually transmitted diseases. The ninth one we're going to be looking at today is vulvodynia. Vulvodynia is another sexually transmitted disease that is chronic condition that results in pain around the opening of the vagina. This one is the pain around the opening of the vagina, and the symptoms can be so extreme, like that even sitting down alone for a long time, you feel very uncomfortable, you feel very so much pain and discomfort in all those areas if one has vulvodynia. Excuse me. I chewed my Active C and I was still talking with it. Hello, I can see people greeting in Instagram. Thank you, Chuku Mambo, and I think I have Babajide. Thank you for joining. All right, water is very good. I use big bottles for my water drinking because I use it to measure. Like I tell people, when I wake up in the morning, very early in the morning, I woke up around 4 a.m. I did my water therapy. I took from beginning to here like 75 cl. This is 1.5. And then I dropped it near my static cycle. and I started having my exercise and praying on my static cycle until I finished the remaining. And then I now got up and took a little walk with another bottle of 75 cl. If you don't finish 3 bottles in a day, you're not taking enough water, especially at middle age. So by the time I start getting to 7 p.m., I now reduce the quantity. So like, this is what I'm going to take until I sleep off. Okay? And then I start off again in the morning. So this should be like my 5th bottle today that I'm finishing. All right. So vulvodynia, like I say, is a chronic condition that results in pain around the opening of the vagina, and symptoms can be extreme. The extreme, like when you sit for a long time, you could feel it. And like I said, vulvodynia is not contagious. It is just a pain that is not contagious, and it cannot spread through sexual intercourse. Okay, so what you do concerning vulvodynia is some kind of lifestyle changes, some kind of home remedies. The first one is to try cold compresses or gel packs. Okay, all these gel packs they put in the freezer, for recent freezers they have. Okay, you can place them directly on your external genitals area to ease off the pain and the itching when you're having such pain and itching. You can also do sit bath. Okay, sit bath that we do when we deliver and we have some kind of tear. Even when I don't have tear when I deliver, I just do that sit bath just for cleansing. Okay, so you can do sit bath 3 times a day. Sit comfortably in a lukewarm, not hot water or cold water. You put some Epsom salt, okay, or you put colloidal oatmeal for like 5 to 10 minutes, okay. And then avoid tight fitting pants wears and nylon underwears. Avoid them. Avoid hot bathtubs or soaking in very hot bathtubs. And then don't use deodorant tampon or pads, because some of those deodorants can actually cause some of those irritation. And then avoid activities that put pressure on your vulva. You need to avoid activities that put pressure there. And when you want to wash gently. It's not by the so much water or washing you put that makes it clean. Scrubbing the affected area harshly or washing too often can actually increase the irritation. And one thing that can also help you is to apply our aloe jelly. Aloe jelly is very, very important. It's a natural lubricant. This aloe jelly is a natural lubricant. I'm brushing my tongue. So it's taking me back to Anambra State. So it's a natural lubricant that you can use. And one fantastic thing about this is that even for people who are having painful intercourse, people who are having itching, people who are having some kind of all these sexually transmitted diseases, vaginal transmitted disease, you can use your aloe jelly because it's a natural cleanser and detoxifier outside. It's topical, it's not supposed to be taken in, that can detoxify and that can actually help you. So it's also good. And then if you're having serious itching, aloe leaf has propolis. It can actually also help you. These two are very fine lubricants you can use. But for aloe leaf, you use it when you can still wash off, because it's aluminum petroleum. So it's always good for you to wash off petroleum, but this one washes off itself. But why this is very, very good is because it has antibiotics, natural external antibiotics on it. So you can combine the two, that they will give you very good results. All right, so the 9th one before the last, which is the bank for us for today, is vulvodynia. Number 9, okay, yeah, we are dealing with vulvodynia. I've already talked about number 9, vulvodynia. All right, so the vulvodynia, like I said, I've already talked about vulvodynia, that is a painful irritation you have. Is not sexually transmitted. So the 10th one now that we're going to talk about is atrophic vaginitis. Okay, atrophic vaginitis, which I said is very, very relevant for our group for aging with grace, because this one now is a condition that occurs when your body produces less estrogen. When your body produces less estrogen, usually after menopause or during perimenopause. So it now results in drying, thinning, and inflammation of your vaginal walls. So because of reduced estrogen. Remember, I said estrogen does a lot for us as women. Estrogen is what keeps us going, keeps us looking younger, keeps us, being firm, having that energy of a woman, especially during our pre-menopause. Remember the stages of menopause? I talked about pre-menopause, which is before menopause, anything during your prime childbearing age, and then perimenopause is when in between menopause and pre-menopause, when you now begin to see all those symptoms of menopause, your estrogen level begins to reduce and things like that. And then menopause is when you have stayed for 12 months without having your period. That's when you are said to have entered menopause. And then post-menopause is done after you have stayed for more than 12, 14, 16, 18 months, 1 year, 2 years, 3 years. You're now in your post-menopause. So symptoms of atrophic vaginitis or could include vaginal dryness, burning sensation when urinating, slight bleeding following intercourse, and genital itching. This could also be part of the symptoms. So, is atrophic vaginitis contagious? No, it is not contagious because it's a condition women experience due to low level of estrogen. That's what just brought this estrogen decrease that brings atrophic vaginitis. So it cannot be transmitted to a sexual partner, though it may affect a woman's sexual experience because that feeling of the vaginal wall makes it very, very difficult and painful for one to have sex. So incorporating sexual lubricant can ease the discomfort associated with this vaginal atrophic vaginitis. And remember, like I said, this should be it should be in beside your bed. Every woman that has entered perimenopause, I'm telling you, stop complaining to your husband. Stop saying he's paining me. Stop disturbing the man. Go and get your forever aloe jelly. Keep it beside your bed and just use it so that you too can enjoy your sexual intercourse with your husband, and so that he too can enjoy. Because what is happening to you is not as if he's a man, okay? It's because you're having reduced estrogen, and it's a normal thing that could happen. So sometimes, in fact, they call vaginal atrophic vaginitis is known as genitourinary syndrome of menopause. Genitourinary syndrome of menopause, which is GSM, genitourinary syndrome of menopause. So when I read it and I said GSM, this one a woman GSM. Oh. GSM only that belongs to women. Wow. So it's like I said, it occurs due to decrease in estrogen level in your body. And so for you to be able to also help it in having your aloe jelly beside you for topical use, you also need your vitalized women. You also need your multi-marker. These two will help to boost your estrogen, at least to help it. Usually when your estrogen level reduces as a lady, as you're growing older, you need to take cytostrogen, which will mimic your estrogen, your normal estrogen. So these supplements will help you to mimic your normal estrogen. Another supplement that helps is your greens, okay? Your greens, they can help you. So because of this postmenopausal, women are particularly prone to developing this atrophic vaginitis. So you can have this atrophic vaginitis if you experience it. Like I said, I'm going to list out some of the symptoms. So you will not begin to feel, oh, maybe it's gonorrhea that is coming or things like that. I know a woman, it's a very, very pathetic story, but I'll tell you here because that's why knowledge is very, very important for you. Knowledge is absolutely very, very important for you. This woman was in her, I think that time she was in her late 40s. She was about 47, 48. It's a true life story, I'm telling you. So she was having some of these issues, perimenopausal and menopausal issues. She didn't know that was what was happening to her. So, because when I saw these symptoms, that was what was actually happening to the woman. She was having vaginal dryness, burning, itches, excessive discharge, vaginal itching, burning or urgency to urinate, increased urinary tract infections coming to her, incontinence and things like that. And you know what this woman did? She blamed it on the husband. She said, hey, it's the husband doing me, this one, this one. In fact, her own got to the case of having like chlamydia, because sometimes when she, after having her period, then the blood will begin to flow again for like a day or two. And then it even extended to the extent of having after intercourse, she will have some bleeding, kind of bleeding. So it increased. But because she didn't know what was really happening to her, she was thinking it was they were doing juju for her. So she was just crying and going from one prayer house to the other, instead of her to look for medical issues that could help her, to come out of this. This is how this woman finally said her husband did that. Her husband and now packed out of her husband's home. Today they are separated. Knowledge is power. And that's why sometimes it's good for us to share this thing. I can remember 2019, the first video I did on menopause. I'll never forget that video. One woman called me from Onitsha. She said, hey, whoa. I will not forget that day. I didn't know that this is what is happening to me. Everything you describe about this menopause is what I'm going through. I say, madam, I ran away from Lagos. That was during COVID lockdown. She said, I ran away from Lagos to go and find out in the village what is happening to me. Right now, I'm in Onitsha. I have not reached my village, and I just put up my phone and I saw you. I started listening. Hey! And I thought it's my husband. I thought it's the village people. I thought it's this or this, what she was shouting. She said, now I know what is happening to me. And that's how I sent her the supplement for menopause. And she, right there in Onitsha, she became very okay. So immediately after COVID lockdown, she ran back to Lagos. She said, this is how I would have gone to waste away in the village, thinking what is pursuing me is from the village. Knowledge is power. So for atrophic vaginitis, vaginal dryness, burning of your vagina, itching of your vagina, excessive discharge, vaginal itching, burning or urgency to urinate, increased urinary tract infection, incontinence. Okay, these are some of the symptoms and signs. Now, what are the remedies? Okay, like scientifically, they have found that for this disease, because it's not sexually transmitted, herbs and supplements are one of the basic things you need. Okay, you need vitamin A, vitamin E, beta carotene, B vitamins, omega-3 fatty acids. They found out scientifically. And I took one of our supplements that is meant for women, especially, which is our Vitalized Women. And I found out that Vitalized Women has vitamin C, vitamin D, vitamin E, vitamin B6, vitamin B12, it has calcium, it has iron, it has magnesium. So for some of us that will go and gather this one is vitamin 12, this one is magnesium, this one is, it's all here, made for you as a woman for you to have. So this Forever Vitalized Women is very, very important. And incidentally, again, our Forever Daily has the vitamin A and the remaining vitamins you need as a woman. And of course, your omega-3. So with these three supplements by your side, you can go on taking your supplements every day for prevention, which is better and safer than cure. And then another thing you need to do also is also to have your diet, nutritious dense diet, vegetables, green vegetables, colored vegetables, do your exercise. Follow us on Saturdays and do your exercise. We come out here on Saturdays and we do our exercise. Last week Saturday was fantastic. You can go down the page and watch it. I showed you some of the menopausal exercises you can do, cardio, strength training, your aerobics and things like that. They are all encompassing. And again, you need to be careful about your personal care products, okay? Avoid using any deodorant or other hygiene products that contain fragrances or chemicals. For example, this is breast cancer month. And this breast cancer month, we are talking to people about breast cancer. Do you know that the deodorant you use can cause cancer? When you use aluminum filled deodorant, they can penetrate, because this is our skin. Things can penetrate our skin. They can penetrate, and when you use them for years, they can cause cancer. That's why I always am an advocate of our Forever Shield deodorant. It's a non-aluminum deodorant that is very, very fantastic for us. So get your Shield deodorant, okay? Use personal products that are not chemical prone. Most of our products are biogenic. They are very, very good, like our conditioner, all made from natural and organic products. Fantastic for hair growth. You see my hair? This is the secret. Yoruba shampoo and Yoruba conditioner. We have everything is organic. Nothing is made from chemicals, okay? All right. So, and then I says, how do you prevent vaginal atrophy? Engaging in regular sex activity may be one of the best defenses against atrophic vaginitis. That's the truth. But you see that women who are this age run away from sex. Yet sex is one of the things that can help, that exercise that can help the lubrication, that can help prevent that atrophic of disease. Now you're a widow, you're like, I'm a widow, what can I do? I can't have sex as a widow, okay? Then you can go on these supplements that I have already listed out for you. And if you're a widow and you're already having atrophic vaginitis, please chat me on my WhatsApp number that is pinned, +234-703-515-1642. If you're a widow and you're having all these diseases I've mentioned, I'm doing a promo for all widows so that you'll be able to stay on this thing month by month, not looking around where to go and have sex. Because some people, one woman even called me and said, they say why I'm having my problems is because I'm not having sex, yet I'm a widow. So I brought up myself to help all widows. And if you're here, you want to also be part of those who can help widows so that they'll be able to get this supplement and be healthy to take care of their children. Also chat me on my WhatsApp number and say, I want to help a widow, and I will tell you what to do. I already have a lot of widows I'm helping who will need the supplement so that they can actually stay healthy and be what they are supposed to be. All right. So while it can be very scary to consider the possibility of contracting a vaginal disease, you should always prioritize your feminine care. Okay, care for yourself as a woman. One bad thing about some of us women is that we don't take care of ourselves. We take care of our husbands, we take care of our children, we take care of the homes. Some of us we even spend so much money on taking care of our homes, our gardens, and everybody, but you don't spend on yourself. You need to take care of yourself. Like I tell women, when you're healthy, when you're firm, when you're your optimal form, then that's when you can produce what can help you to take care of others. Okay, so join me, chat me on my WhatsApp number if you want to become one of the 100 influencers who will use your talent, your hobby to touch other people, to reach other people all over the world using social media. Okay, chat on my WhatsApp number and then I'll show you how to do it. If you need these supplements to buy them at a discounted rate, chat me also on my WhatsApp number +234-703-515-1642, or also you can actually help. If you want to be a helper, chat me so that I can also give you what you need to help others. Thank you all for joining me. I really, really appreciate you. See you on Wednesday. We are cooking on Wednesday again. We're going to cook some of these foods that can help build up your estrogen. Okay? Love you all. Bye.